Hi, my name is Dr. Jennifer Bresnick. I'm the director of the Physical Therapist Assistant Program at Norwalk Community College. When people consider physical therapy as a career choice, one of their first questions they ask me is what is the difference between a physical therapist and a physical therapist assistant? A physical therapist, or PT, completes a bachelor's degree and then a doctorate in physical therapy. Then the individual takes and passes a national license exam, which allows them to obtain a license to practice as a PT. A physical therapist assistant, or PTA, completes a 2-year associate's degree and also has to pass a licensing examination and become licensed in the state in which they plan to practice. You can see that there are some huge cost differences as well. Becoming a PT costs about 10 times more than becoming a PTA, and a PT doesn't make 10 times more than a PTA, only about a third more. NCC proudly offers a budget-friendly, high-quality PTA program that will give you a bright future. How do I know it's high quality? Well, for one thing, 100% of our graduates pass the licensing exam. Only about 20 programs out of 250 in the whole country can say that. The PTA works under the direction and supervision of the PT. What that means is that the PT performs an examination and evaluation of the patient, then comes up with a plan of care. The PTA then helps to execute that plan of care. The plan of care might include things like therapeutic exercises, such as strengthening, range of motion, or posture exercises, and patient education. Or physical modalities, such as hot packs, ultrasound, or electrical stimulation. Or functional training, such as helping a patient learn to walk and balance after a stroke so they can complete their normal daily activities. Or manual therapies, such as joint mobilization, lymphatic drainage, or airway clearance for a patient with a pulmonary condition. One of the benefits of the physical therapy profession is the variety of treatment settings and diagnoses you can choose from. Here are the 4 major categories of physical therapy intervention. We can help patients with their musculoskeletal systems, their nervous systems, their heart and lungs, or their integumentary systems, or skin. When I was a hospital PT, I could see all of the diagnoses listed here in the span of just 1 week. There is a lot of variety in the physical therapy profession. PTAs can work in hospitals, skilled nursing facilities, outpatient clinics, schools, and homes, just to name a few settings. All of our graduates have jobs as PTAs in all of these settings. If you volunteer or observe in a physical therapy clinic in Connecticut, you'll probably meet 1 or 2 of our graduates. In fact, the best way to see if physical therapy might be right for you is to volunteer or observe in any facility that has PTs and PTAs on staff. Get a close-up look of what physical therapy is really like before you invest your time and money. You'll also meet one of our admissions criteria, which is to spend 40 hours observing or volunteering. Don't worry, any facility you call is going to know exactly why you want to observe. It's kind of a thing in physical therapy education programs. During this program, you'll begin with a foundation based on anatomy and physiology. We sometimes joke that we know the bones and muscles so well, it gives us X-ray vision. It's a lot of work learning all 206 bones and 600 or so muscles, but it's knowledge you'll need to be able to treat your patients effectively. For example, why is it that if you fold your middle finger under and put it down flat on the table, that you can lift all of your fingers easily except your ring finger? A PT or PTA would know the answer to that question. The answer, it turns out, is the extensor digitorum. The extensor digitorum is this muscle in purple. In order to move the middle and ring fingers, the extensor digitorum has to be able to move. With the middle finger tucked under, the muscle can't move, and neither can the ring finger. Plus, all of the other fingers have their own muscles separate from the extensor digitorum that by themselves can move those fingers. Why is any of this important, except for maybe a party trick? Well, because we have to know which one of your 600 muscles is not working properly, so we can fix the right one. For example, I have a brother-in-law named Harry. Harry came to see me because he had shoulder pain. Now, Harry isn't all that tall, but he is very muscular and strong. He needs to be strong to be good at his job, a firefighter in Washington, D.C. In order to be strong, one of the things Harry did every week was 400 push-ups. So why did his shoulders hurt? It couldn't be from lack of shoulder strength, but it was. When I tested Harry's muscles using a technique you'll learn called manual muscle testing, some of them were strong. The big ones that lots of people know about, his pectoralis major, triceps, and deltoid, were all very strong. But when I looked at some of the other muscles, I found a lot of weakness. His rotator cuff muscles were very weak. Push-ups make those other muscles strong, but not the rotator cuff muscles. What do you think the function of the rotator cuff muscles is? These smaller muscles pull the humerus bone away from the bone above it, called the acromion. This wasn't happening with Harry. These muscles were weak and his bones were rubbing together and causing him pain. So I gave him some exercises, specifically to strengthen the rotator cuff muscles, and he got better, no more pain. The PTA program at NCC will teach you these kinds of things and so much more. You'll spend 3 semesters learning about pathology, kinesiology, and physical therapy interventions. In your 3rd semester, you'll spend 1 day a week at an internship at a local hospital, nursing home, or outpatient clinic. Then in your 4th and final semester, you'll spend 7 weeks in a full-time internship at the beginning of the semester, and then 7 weeks full-time at the end of the semester at a different location. These final internships are usually where our students find their jobs that begin as soon as they pass the licensing examination, about 1 month after graduation. For more information about the Physical Therapist Assistant Program at Norwalk Community College, begin by reading the information packet available on NCC's website. Go to norwalk.edu/PTA and click on PTA Program Information Packet. If you have any questions, our contact information is on the first page. You'll work very hard in this program, but at the end, you'll have an exciting career ahead of you as a physical therapist assistant.